really pleased to be here. I joined the South Bay Community Services Agency, which is one of the largest social services agency in Southern California. We're also, Chula Vista, our area is 3 miles from the Mexican U.S. border. So you can imagine that our population is a very transient one. They have families going back and forth, and we are our large percentage of Latinos, many of them Spanish speaking, and we're now going through the angst of many of our families with immigration and accessing services. That said, what Jessica was saying is we have to feel the pulse of the community and come together to see what's going to work and what do we need to change to be supportive of our community family, because this is what we call family. So I am here today to basically talk about our 0 to 5 population, although when you see our pillars, the Cradle to Career, there are 2 pillars or 2 areas that I oversee at the elementary school. Which one is, sorry, this one? Okay. So this is, So this is the Castle Park catchment area, and it was selected by the 2 superintendents in our area, basically because this area had the lowest attendance rate in school, in the 88%, 89%. They also had lower academic achievement, program improvement schools, and a very diverse area that they felt this initiative could really maybe make some difference in the transformation. So there are 5 schools. The elementary school is Castle Park, and then it feeds into the 2 middle schools, and then we have the 2 high schools. There are other elementary schools that feed into it, but they focused on the 1 elementary school in our initiative. So we had 5, and currently in our 2-year extension, we have expanded to 2 elementary schools that also feed into the middle schools. So going forward now, we have 3 elementary schools. Our baseline data of what to do and what would be the best reflection of the community was based on our community survey. We had SANDAG, which is the San Diego County Association of Governments, work with volunteers in our community, because not everyone will open a door to someone that they don't recognize, but if they recognize them, they'll open the door and actually talk to them. So it was a partnership of our volunteers in the community and SANDAG researchers coming in to ask questions about the community. And we just pulled out 3 that really we felt, the early learning. You could see there that there were many adults who had not completed high school. Another piece that we didn't include here is that majority of the households had only 1 parent as the head of the household, mothers. And 62% of our children were not attending preschool. And so based on those 3 areas, we had to design what's the Cradle to Career. So this was a work of many partners coming together with South Bay Community Service, who has a very close relationship with them, coming to the table when it was the RFA to turn in a grant and saying, okay, this is what our community needs based on the demographics that we have collected. So together, they put together a series of solutions by the different areas, starting with the early childhood all the way to college and career. This journey is about ensuring that children gain access to the necessary education, medical, self-sufficiency for the family, and that equips parents. A very important part of this is the parents, that they know what they need or how to get these resources in the community or beyond. So the solutions include a wraparound services where we are able to refer families to agencies or services within our agency and beyond, and have people on site. So there are parent centers at every school in which the promotoras staff the parent centers. We've also been able to bring in outside resources to be at those centers. So Health and Human Services is housed at one of our schools. That makes it very easy and very close to get our families there rather than having to tackle the big agency. We also have therapists that can help with assessments for children who are exhibiting maybe needing mental health. And also we have staff from Healthy Development Services housed at my site that we can have that quick referral right there. So we try to minimize the amount of time that families have to wait to receive any kind of referral that they may need. So in looking at our early learning intervention programs, we have several targets, and there were one overarching target for this group is children enter kindergarten ready to learn, ready to hit the road running and be successful in kindergarten, which has changed so dramatically in the last years. And under that umbrella, we have certain goals. One of them is, are they connected to a medical home rather than going to emergency room? Are they meeting the developmental milestones? We're looking at our 3-year-olds. Are they being referred to intervention as needed? Are they participating in either center-based or home-based preschool? What is our transition to kindergarten? How are we preparing our children and our families? And then, is there home literacy? Do they see the importance of reading at home and to develop language? And the wellness component. Are children active? Are they eating fruits and vegetables? So we strengthened our work by having our partnership with medical services. So we have 2 hospitals in the area. And we had the home visiting program where nurses, and this was a funded partnership, where any mother who had a baby in one of those hospitals, they received 6 months follow-up with a visiting nurse. And in addition to that, they then referred them to our development specialists in our program, and we continued the connections with the moms and so on, inviting them to our programs, and just having that one-on-one with the mothers. In addition to that, any children that needed medical attention and so on, there's also a mobile clinic that comes to the school, and also some of the other schools. And so again, access to services that we can get the families to, because many of our mothers don't have cars, and it's hard to get on the bus and so on with little ones. So if we could bring the services to them, we're meeting the needs of our community. In addition to that, we worked with the first 5 Healthy Development Services to bring parent workshops to our center. And so we have development workshops, we have behavioral workshops, we also have workshops on nutrition. And lastly, we outreach to child care providers. We had about 6 to 8 child care providers, and so our development specialists would go out to them and make the connections and help them, because again, they were part of our children ready to enter kindergarten. And lastly, our family self-sufficiency. We refer families for job, housing, emergency need as the family needs, and so on. So I'd like to share with you one of the data trends that had us initiate this program. We had originally a preschool program that only had 40 slots. And so as the word got out and parents were now bringing the children to a preschool that was right there in their neighborhood and very close, we found that we gave preferential treatment to the 4-year-olds that were getting ready to go into kindergarten, right? So what happened to our 3-year-olds? And we're supposed to collect data on the 3-year-olds. So we sat down and we looked at our database and said, what can we do? And so following the model of identifying the problem and all the indicators, we worked with our healthy development partners and we said, okay, why don't we bring a development class for parent and children for the 3-year-olds to you? So we had a little room that was given to us at the school, not very big, and so we planned it out. We worked with our data team as to what's our outcome. What are we going to use as indicators for, is there a change in the parents pre and post? What is success? And after we identified that, we began the recruitment, and we've been able to serve, as you can see here, in the last 3 years, 200 families. And we did that by having parents come 3 days a week for 2 hours each for each quarter. So we built everything around the quarter system because that's what our school is based on, the quarter system. And our development specialists and the healthy development partners facilitated the workshops. It was such a great success, and then we said, we need to expand now, include our infants and toddler population. What made a difference in this is that the parents were engaged. They said, I have never sat down to really play with my child. When we also had the behavioral class for those children that were showing signs of having, parents were struggling with them at home, we brought in Para las Familias, which is a behavioral intervention. They gave a class one day to the parents, and the next class was with their child. So they put out the mats, they had specific activities, and the parents had to sit and apply what they learned with their child. And then you have the therapists who are the critical friend, coaching them along the way. And then they this has been a phenomenal, transformative solution for our families because they were just not used to being in this kind of setting. We're talking primarily Latino families, that this is a new practice for them. And so for us, this was a highly successful solution that was not part of the original one, but again, responding to the needs of our communities. Our preschool is another one where we looked at the data and what do we need to do to change things. It originally started, as I told you, with 40 children, and because most of our families are Spanish speaking, it had to be a dual language program. So we had 2 classrooms, dual language, the original model, full day, all year. Well, we found out that that was not what our community needed, because when it was time to have the first break and we were ready to have classes, our kids were not there. They were home with their brothers and sisters and mom because we're intercession break. So that made us go back to the drawing board and say, okay, this full day model is not something that is working right now. So we waited another 9 weeks, and sure enough, at Christmas time, we had the same thing. So we went back and we said, okay, we need to align ourselves to the school calendar. So it has to be that when the school is out, since most of our families are coming from the school, then the preschool needs to be closed. And that has worked because it allows us then to use the intercession breaks to meet with parents for conferencing. It also allows us the time to provide professional development to our staff. And then they take their vacations when the kids are not there. So in 2016, we also saw that we still had a lot of kids on the waiting list. And in the afternoon, many of our parents were pulling their children out because they wanted to go home with the school-age children. So from 2:15 to 4:30, we had very few kids in our preschool. 4 staff, very few children. Again, let's go back and discuss what's not happening. And so we collected the data, submitted it to the group, and we said, we are proposing a hybrid model in which one classroom becomes a full-day classroom for those working parents or parents going to school, and then the other classroom becomes a half-day following the state preschool model, morning session and afternoon session. And because of that, we were able to increase our preschool from 48 children to 72. So again, we were able to do a population increase and address the needs of our children. We have served over close to 300 children in our program. We have a kinder camp, which we offer in the summer, 3 weeks. As soon as preschool is out and the regular school is out, we move over to the school side, and we do a STEAM-based curriculum activities with the children. They are now into kinder routines versus preschool routines. They have the acclimation to school, which playground to use, the routines in the cafeteria, which is a biggie for incoming kindergartners. We work on social emotional lessons. We have enrichment field trips. And the most important component is the workshop for the parents. That starts in January before the end of the school year. And we work with our parents on understanding the school routines and expectations for kindergarten. The importance of attendance and tardiness. The importance that, you can get a call and it's very serious if you don't get your child to school on time. Preschool was a little different, but now that you're in kindergarten, you have to be to school on time or the gates close. We shared with them the academic standards, examples of what is expected in reading and math for their children, and understanding that they start to write. They have to learn words. They have to learn to read those words, and that's very different and was very shocking for many of our parents of what kindergarten looks like. And the importance of routines, that they have to be ready. And so what are some of the home routines that they need to work with their children now so that when July comes around, they'll be ready and parents will be ready as well. And then how to be a volunteer. So in the camp, we brought in our parents to do activities with their children, get them acclimated to the classrooms, and they say, you are a big part of the school, and so your participation is very important, and we encourage that. In order to see if our children were making demonstrating appropriate functioning, our exiting preschoolers, getting ready for kindergarten, we administer the Scholastic Kinder Readiness Test. And as you can see, our baseline was in 2014-15, we started at 81%, and this last year, we were at 98%. And the levels, the number of children increased because we brought in the 72 children, which included the 3-year-olds and 4-year-olds. That increase, someone asked me, well, how did you get that increase? And, a lot of it was professional development. We worked very closely with our teachers. The ELL coach is a retired teacher who's also a special ed teacher, and she just worked a lot in getting to understand and let's look at practices. We brought in tutors into the preschool classroom so that we can have a ratio of 1 to 8 for the small group. Having a dual language classroom, you have to have Spanish groups and English groups, and then you have to have English development as well. So we invested in staffing to make sure that that program was successful. We also included our parents in this. So we would send home activities, we sent home books that would support the readiness of our tests. As we think about what is working well for us at the local level, the use of data. We had to become comfortable, and like I said, I came from a school setting where I was a school principal, and with the No Child Left Behind, we had to become very versed in and comfortable in looking at our data and how that impacted our instructional support. I continued that, and it's not easy bringing staff along, so you have to make it in a way that we all own the data. So we sit down regularly to look at our outcomes, Is it working? Are we meeting our benchmarks? If not, what do we need to do differently? We explore it. We bring others to hear our process, and then we monitor very closely that. And we also look at the progress. We engage our parents from day one. I think that's one of the key for us. They see us, they feel comfortable with us, they come to us at all times, they call us. Hand holding if they need to go to the district or any kind of intervention, we're there. And they also come to the school, and they're more open now in participating and volunteering in community activities with their children. And lastly, we invest in capacity building. We cannot do what we're doing if our staff is not up to date and current, and we collaborate with all our partners. And what has impacted our community? Understanding the importance of early intervention. And so we have many of our children now in the preschool, if not ours. They're going to the closest preschools available. We have strengthened the caregiver and home programs. Development specialists go out and work with them. We've established wellness policies. We have a community garden. Our children go to it. They know that fruits and vegetables make us healthy over chicken nuggets and cookies and cakes, and they love to eat vegetables. And they tell their parents that they eat vegetables. And we've also included our intergenerational volunteers in the community to come in and work with the children, and it's a joy to see grandparent type working with the children, and they hug them and they say, oh, you remind me of my abuelita. And so that has impacted our community. What's next for us? As I said, we are looking to expand and bring in more volunteers from the community, and we're establishing parent centers and programming at 2 additional schools, as well as expanding our resident leadership academies, which is our community advocacy group. These are all our partners that we worked with, and we couldn't do the work that we do without them. And lastly, if you like us, you want to know more about us, we're in all these social media centers. Thank you so much.